Pregnancy-related lower back pain. Now, this is a very common complaint that we see quite a lot, and there are quite a few things that we can do to help sort of lessen the pain and discomfort that you may be experiencing. But first of all, I'm going to quickly just talk about why we experience lower back pain when we are pregnant. Now, as you may well know, when you're pregnant, your body, such as your reproductive organs and a couple of systems within your brain, release hormones to help support and aid your pregnancy. Now, one of those hormones, unfortunately, is relaxin, and relaxin, in its name, relaxes all your muscles, your tissues, your ligaments, your joints. And this happens to prepare the woman for childbirth. So, as sort of you reach your final stages of pregnancy, the pelvic sort of what we call inlet, which is a little circle that the baby's head goes through, is able to open up enough for the baby to actually be born. Now, that obviously is going to cause a lot of problems. When you are growing the fetus, growing the child, there's obviously going to be a lot of weight on the front part of your body. Now, that's going to change your center of gravity, and it's going to require the muscles of your back and your glutes to work a bit harder. However, we've added this relaxin hormone in, and so you haven't quite got that support that you once would have had if this were to occur without the hormone. So, unfortunately, this places a lot of strain on your joints in your lower back, and it can also cause what we call pelvic torsion, where one of your pelvic bones may become fixed in a certain position. Now, there are a few things that you can do. However, I do want to stress these don't cure it at all. These don't get rid of it, because unfortunately we can't get rid of the hormone relaxin, but these should sort of help you ease your pain a little bit. So the first thing that you can do is actually quite a funny one to say. So during the second trimester, a lot of women experience constipation. Now, what you don't want to do is strain, and I'll tell you why. So in the second trimester, progesterone levels increase quite a bit, and this is responsible for that constipation. I know hormones are very annoying. So as you obviously are in the second trimester, you may feel yourself constipated, and you may feel like you're trying to push more to go to the toilet. Now, as I said before, this hormone relaxin, it influences your joints, your bones, your muscles, your ligaments, your tendons, everywhere. So as you're pushing, as you're bracing, your intervertebral discs, which are a part of a connective tissue, will have more pressure applied on them. And as I said, that sort of support system isn't going to be quite 100% like it used to be. So you're actually increasing the risk of injury to one of your intervertebral discs. And the second thing that can happen if you are bracing is you can strain one of your facet joints. Now, facet joints are two side joints that are on each vertebrae, and they connect one another. So by straining, you can actually sort of sprain one of the capsules that keeps it together. So addressing any constipation with your healthcare provider is key and essential to preventing any other further damage to the back. Now, please don't feel embarrassed to do so. There's always one thing I like to say to anyone who comes and visits us and is a little bit shy: we've seen worse. So please don't feel embarrassed at all. The second thing that you can do is strengthen your pelvic floor muscles. Now, I know this is probably, you've heard it before. However, I cannot stress enough how important they are. So your pelvic floor muscles are like an upside down umbrella, okay? And when you push, they contract, and they have to hold all of your abdominal pressure. So again, if we use the example of going to the toilet, if you're pushing, your pelvic floors are having so much weight of your abdomen, even if you weren't pregnant, just your abdomen, plus the fetus pushing and bracing down on these muscles, and they can get weak. Now, your pelvic floor muscles, as I said, are an important structure of your core. You've got a few core muscles, I won't bore you with the details, and your diaphragm. And your core muscles act like a corset. So when you breathe out, as most people do when they strain, these sort of corset muscles come closer together. Now, if you've got strong pelvic floor muscles, it will help maintain that posture and it reduces the strain that's placed on your lower back. However, if your pelvic floor muscles are weak or they're just not working quite the best as they should, then your core muscles, your corset muscles, sorry, are going to contract, which bring your spine a little bit forward, but they're not going to have that underneath support. So you're actually putting your spine into a little bit more of a position that it's not too comfortable with, and there's no support there. So exercises such as holding in as if you needed a wee. Now, I don't want you to do this on the toilet, but just sitting down where you are right now, if you think of that feeling when you do need to go to the toilet and you squeeze in, trying not to let yourself go, then that's the sensation that you want to be feeling when you're doing this exercise. So you're going to do it 10 times, so almost pulsing. So you're going to squeeze in one and relax one, squeeze in one and relax one. Then what you're going to do is you're going to squeeze in, and this is quite hard and a lot of people struggle. You're going to squeeze in, trying to really, really hold for at least 10 seconds and then breathe out and relax. Now, a lot of people only get to about 3 or 4 seconds, and that's absolutely fine. Just stop, go, okay, that's my challenge, to beat 4 seconds and then redo it again. And the final thing that I'm going to say is pregnancy pillows. Now, I love a pregnancy pillow and I'm not pregnant. So when you sit in a position, and this is for everyone as well, not just pregnant ladies, but when you sit in a position and you've got a little bit of discomfort, you might try and find yourself twisting in odd sort of ways to relieve that pain or discomfort. Now, although it may be sort of beneficial in the meantime, when you get up, you may experience sharp shooting pain or real stiffness that leads into pain. And this is because, especially whilst you're pregnant, that hormone relaxin loosens up those muscles. So if I'm twisted with my leg sitting or sleeping, all these muscles here are overstretching. Now, your muscles then act like a spring. So once you pull them, they never quite go back to that firm, hard spring. And that's the same with the muscles. So when you get up, that's when you feel the pain. So if you place a pillow, if you lie on your side and you place a pillow underneath your leg so it stays in this alignment with your hip, or a big one is placing a pillow underneath your bump if you lie on your side, or just placing a pillow in your mid-back, so where your bra strap area is. That's just going to keep that spine nice and neutral and not slouched or too far flexed in this position. So I hope you found this useful. I know I do like to talk a lot. So this is why we have now created a blog, and you can find out more information by clicking the link that will lead you to our blog.